When you're on the C&E journey, it can become discouraging and even overwhelming, but you don't have to struggle alone. At Dr. So's Educate, our mission is to support you on this journey to achieve nurse educator excellence. For some, that is becoming a certified nurse educator. For others, maybe not. Whatever your path is, as you join us for this snapshot, we want you to know you're not alone. Our mission here at Dr. So's Educator is to do exactly that, to walk alongside you to help you achieve success. Welcome back, everybody, to Dr. Sellers Educate. We're excited that you're back. If you haven't already, you want to go ahead and pull out your resources. Okay, so first and foremost is going to be Billings and Halstead Teaching and Nursing. This is the sixth edition. I'll tell you why in a second that we are using the sixth edition. The second resource we want you to pull out is your study worksheet. Now, that's listed right here in the description. So you can click on it, download it, print it out, and there's a reason why. We are at least 50%, some research says 70% more likely to retain information when we physically write it down. That's why it's so important to print out this study worksheet. You're going to write down the date that you're watching this snapshot. Hopefully you're watching it live, but if not, you're watching it as a recording, then you want to go ahead and write down today's date. The second step, what is your objective? What is it that you want to achieve after we have ended our time together today? All right, so step one, pulling out Billings and Halstead. All right, and I'm going to give you page numbers that you want to make sure you review at the end of our time together today. And step two is printing out that study worksheet, writing down the date, writing down your objective. What are you going to achieve at the end of our time together today? We are using the sixth edition as of right now because this is the one that was mapped to the current exam blueprint. Okay, now the seventh edition is also available. It's a wonderful resource. We have that one as well. In fact, I have, I think now, six editions, so six out of the seven on my bookshelf. All right, so sixth edition is the preferred textbook version, but if you have the seventh edition, that's great too. When you're looking at the sixth edition, we want you to focus on pages 188 through 190 as we continue to explore the three learning domains. Okay, so go ahead and put in the comments for me. What are the three learning domains? Even if you're watching this as a recording, I want you to still put it in the comments for us. Our goal is to reach as many nurse educators as possible. So go ahead and subscribe to this channel so every single time we release a new snapshot, you are notified. Okay, so click the notification bell as well as the subscribe button so we can stay connected and notify you as soon as a new snapshot is released, which usually happens every week. All right, so we're focusing on the three learning domains. We introduced that two snapshots ago with the cognitive and then the affective, and now we're going to explore psychomotor. That's right, three learning domains. If you got them right, go ahead and give yourself a round of applause. If you did not, that's okay because you have resources. That's what we do for you. We provide resources and support to help you on your journey to achieve nurse educator excellence. All right, so let's go ahead and jump in. We're going to start a little different this time. We're not going to start with our thought-provoking question. We're going to go ahead and jump into our content. We do want to do a little bit of a pre-assessment though. All right, so this is what we want to know. How are you feeling? What is your number? We like to do what we call a temperature check on what your knowledge level is related to this topic. Now, this content is aligned with competency one as well as competency two and competency three, because competency one for the C&E exam is all about how do I ensure I am effectively facilitating the learning journey with my students. Competency two is all about learning about our students. Who's in the room? How do I connect with them? All right, so competency one, how do I ensure I'm being a really good teacher to facilitate that learning? What are those evidence-based practices? Competency two, how do I connect with my students? Learner socialization, right? And making sure that I'm meeting my learners where they are, right? Based on level, based on the social determinants of learning and the challenges that my students are facing in the classroom. And then competency three, which is all about how do I assess? How do I validate that learning has happened? So just thinking about learning domains, how do I evaluate and validate? What's your number? One, you feel lost related to these concepts. Maybe it's a little bit of alphabet soup. You're feeling like that you're already having thoughts about as I'm talking through some of these terms. So maybe these are foreign concepts for you. Or five, you feel like you're ready to teach. You know all the learning domains. You've joined our program before. You're familiar with these really important concepts that are going to help you be a better nurse educator. We also like to share testimonials. If you have not checked out our LinkedIn page, we encourage you to do that. Dr. Sellers Educate is our LinkedIn page, and that's where you're going to find testimonials every single week on Tuesday. We call it our Testimonial Tuesday because we want to encourage you by sharing stories and just snippets of how other colleagues have celebrated their wins and what they have to say about their journey. So you can see here that this testimonial cited that Dr. Sellers Educate is an excellent resource or excellent source for not only CNE study, but to inform the practice of nurse educators. Any instructor or course would be improved by having faculty skilled, knowledgeable, and given attitude developed from this educational content. We love that testimonial. All right, so we've done a little bit of an introduction related to the three learning domains. You've done a little bit of a self-assessment, and now we're going to go deeper because that's what this journey is all about. It's not enough just to have that surface learning, right? You have to go deep in comprehension of these concepts. So, what and why? That's what we're having a conversation about. We introduced that in the two previous snapshots, and now we're going to have a deeper exploration of the psychomotor learning domain. So, what is it and why is it so important? When you are preparing for the CNE exam, you want to know what is the definition of that learning domain. Pages 188 again through 190 in the sixth edition gives you a deeper understanding as it relates to the definition. The next must know is going to be the verb. So each level of Bloom's taxonomy has verbs associated with that psychomotor learning domain. Pages 188 through 190 is going to give you that deep exploration and explanation of the verbs associated with the psychomotor learning domain. And then assignments. So what type of assignments, what type of assessments, how do I validate that learning has happened across the psychomotor learning domain? What does that look like? All right, so those are the three levels, I like to call them, related to the knowledge that you need associated with those three learning domains. All right, so here's our thought-provoking question. You want to stay to the end where we debrief related to this thought-provoking question. And this is what we want you to really gain from these thought-provoking questions. What we know, because we get this question a lot, so let me stop sharing for a second. I want to go on full screen because we get this question a lot. Does it help you to review more questions, more practice questions to get ready for the CNE exam? This is our answer consistently, and that would be no. And it's because this is the advice from the NLN commissioners. They do not want you spending time going over practice questions. This is what we know the benefit is of the self-assessment exam for about half of our nurse educator colleagues. So it can help you become more familiar with standardized type of testing. Again, we're talking about the NLN self-assessment exam. We're not talking about practice questions that you may purchase through other vendors. All right, so we're only talking about the NLN SAE. We say it only helps about 50% of nurse educator colleagues because that's the feedback we've gathered. So about half colleagues say the SAE was helpful, the other half not so much. So this is not NCLEX, okay? NCLEX, absolutely, we know the evidence shows that students who engage in complete more practice questions and process the rationale for the incorrect answer and correct answer have an increased likelihood of passing NCLEX. So yes, evidence shows that for NCLEX, but not for the CNE exam. You may see some colleagues that do respond in different social media sites that say, "Oh, I use these practice questions and that's what help me to pass CNE exam." This is what we know is actually true. The practice questions that colleagues may use sometimes may help them have a deeper comprehension of the concept. So it's not that it's the practice questions that may help colleagues, it is the fact that we go deeper in comprehending the concepts, especially when we don't choose the correct answer. So again, we get this question a lot, so we want to go ahead and dispel the myth. It is not going to increase the likelihood of you to pass the C&E exam just because you are taking or using practice questions to really help you solidify your knowledge. Because this is the reality. Those practice questions are not written by exam writers. That would be a conflict of interest for the C&E exam. We would recommend, to align with NLM recommendations, that you focus on the concepts, okay? Reviewing the concepts to ensure you have a deep comprehension of the knowledge. That is going to be the number one contributing factor to helping you pass the C&E exam. It's going to the evidence. Okay. So we want to go ahead and dispel that myth because we get that question so much. Now let's go back to our content and talk about our thought-provoking question. And that's why we share these as thought-provoking questions, because they are not practice questions. All right. Practice questions are those that have been developed, such as with Dr. Caputi's C&E review book. They are practice questions that have been developed by expert exam writers that have experience with NLN. Okay, Dr. Caputi obviously is a cited recommended reference by NLN, and that was in the previous handbook edition. We know that it's no longer recommended, or at least on the recommended list, but we do know that those practice questions in Dr. Caputi's C&E review book, second edition, has helped some colleagues. And same thing, some colleagues it has not helped. All right, so now let's get back to our thought-provoking question. Now that we have dispelled the myth and we've clarified the purpose of the thought-provoking question, okay, which again, when we talked with the NLN commissioners a couple of years ago, they did encourage us to continue to have these conversations around our thought-provoking question because we want to stimulate thoughts, okay? And we're going to debrief at the end about the rationale for the correct and the incorrect answer. So during a lab session, students are learning about urinary catheter insertion. After watching a demonstration, students practice in pairs using mannequins. One student completes the procedure but contaminates the sterile field midway. The faculty member observes, pauses the student, and provides corrective feedback. Which response best demonstrates advancement in the psychomotor domain of learning? A, the student reflects on how respecting patient dignity should guide catheter insertion practices. B, the student repeats the procedure, successfully maintaining sterile technique after applying the instructor's feedback. Or C, the student accurately describes how they would avoid contaminating the sterile field in future practice sessions. When you get to your questions on the C&E exam, we want you to have two thoughts, okay? The first thought we want you to consider is, what is this question really asking me? Sometimes there can be a distractor in the STEM, meaning that there may be unnecessary information that is included in the STEM that will not help you choose the correct answer. The second thought we want you to have is, what do I know about content or concepts included in this question? When you get to the C&E exam, there are three options. Only one is correct. Okay, so they updated all three exams some time ago. So only three options, one correct option. All right, so you want to go ahead and think about now, what is your answer? If you feel confident putting it in the comments, that's great. If not, just hold on to it, write it down on your study worksheet, and we're going to go back at the end of our time together in this snapshot and talk through the rationale. So key takeaways we want you to have from this snapshot. All right, so the first takeaway we want you to write down is skill acquisition requires guided practice. We want to be the guide on the side when it comes to us encouraging and really facilitating the learning process related to application and demonstration of competency. Skill acquisition means that we need to give them feedback, right? Just like we heard about in our thought-provoking question. Whenever students are demonstrating a skill, we don't want to wait. We don't want a lot of time to pass between the time students demonstrated that skill and the time we're giving them feedback. This is a concept called deliberate practice theory that says when we are able to close the loop and provide that feedback in a short span of time, students are more likely to retain that information, make the correction, and have an increased likelihood of making a better decision the next time or correcting their error. Okay, so that deliberate practice theory, we want to close the gap, the lapse in time between the time we teach the content and the time we give feedback so students can relatively quickly have a chance to repeat that clinical practice decision and hopefully get it right. Students do learn best through demonstration, practice, feedback, repetition. Again, demonstration, practice, which is application, feedback from their faculty in close proximity to the time where they've made that practice decision, and then we want them to repeat it. If students have opinions or feelings associated with that feedback, we want them to have time to process that, right? Going back to that effective learning domain, because we want students to demonstrate improvement in their skills. And that requires us to be sensitive to the fact that our students learn differently. We want them to have time to process that information and then hopefully increase their performance and achieve competency and improve their performance as well. Second takeaway, progress that psychomotor learning domain and skills actually progress from basic to complex performance. That's what we want to happen, right? We think about scaffolding of learning where students are building on prior knowledge, they're building on prior skills that we have validated with them in order to advance their knowledge and to be able to competently perform and demonstrate complex care situations. All right, so we have uh, an explanation associated with this takeaway. Learners are able to move from simple motor skills to integrated clinical procedures that require more complex coordination and precision. A good example is going to be therapeutic communication, right? There's a reason why we have health assessment and foundations or fundamentals early or at the beginning of our nursing program because there are so many fundamental and core skills that are the foundation for our nursing students that they have to build on. And then as students progress, we want them to be able to apply sterile technique and insert Foley catheters and insert IVs and be able to take care of a complex patient such as a heart failure patient, right? So we don't start out with asking students to care for a heart failure patient, right? Because that's complex care that's associated and necessary with making patient care decisions for that type of patient. So we want to start them with those lower level skills that are essential, but are not as complex or do not require as much coordination. So, as we said, an example would be beginning with proper hand washing and progressing to preparing IV medications and eventually managing multiple IV lines, such as during simulation. Again, that's going to provide some formative feedback for our students so they can make the necessary corrections. The repetition part we know is essential with the psychomotor learning domain. Giving feedback is essential as well. And then the third key takeaway is that performance must be measured against standards. What do we mean by that? Knowing that competence is evaluated through checklists, right? That's a standardized practice that we should ask students to follow based on the evidence. So there are steps the students are going to follow to ensure that they are being guided through sterile technique processes aligning with the evidence, rubrics, simulation assessments that are aligned with clinical expectations, again, based on the evidence. An example would be using a detailed skills checklist to assess whether a student consistently, that word is essential, right? Consistently maintain sterile technique during Foley catheter insertion. And if not, we're going to give students that feedback so they can make corrections. If you chose B, give yourself a round of applause. The student repeats the procedure, right? Going back to repetition. We want to give feedback and we want students to make corrections in their performance. We are always delighted and excited to share when colleagues have been successful on their C&E journey. We were delighted to meet one of our faculty that have been a part of our Dr. Solis Educate program, Dr. Samuel, during an NLN Summit previously, and we hope to meet some of you at the upcoming NLN Summit as well. There is a certification reception, and for those that are certified and coming to the summit, we always like to go to that reception. It's a delightful experience, and we hope that we'll be able to meet you there as well. So, again, the goal is that these are encouraging words to keep you all motivated, and make sure you also check out our LinkedIn page. This is where you're going to find more testimonials. In fact, and that's Dr. Sellers Educate LinkedIn profile. In fact, we share a testimonial Tuesday where we are sharing our colleagues' journey regarding the C&E process. All right, so stay encouraged. We know that it can feel overwhelming at times. And so hopefully what your number was at the beginning related to learning domain competency one, competency two, and maybe even competency three, that you did that self-assessment at the beginning. We hope that that number has progressed in the positive way, just a little at a minimum, as you're thinking about now post-assessment, what's your number related to your knowledge, specifically with psychomotor learning domain, or the three learning domains are how you assess and evaluate students to align with that level of learning. Okay, remembering those three key takeaways, hopefully you wrote those down, and you're going to now take some time to debrief, pausing and giving yourself some grace, showing yourself some grace, as we know that this content can be complex for many nurse educator colleagues. You want to reflect on what is it that you don't know, and also celebrate the knowledge that you have been able to grasp or that you came in with during the snapshot. And then we want you to take action. 70 to 80% of the questions on the C&E exam are at that application and analysis level. So it's not enough just to have that foundational knowledge, that lowest level of remembering or trying to memorize as outlined in the cognitive learning domain. We have to go deeper. Okay, so that requires us to get to that application and analysis level. And when you're able to integrate these evidence-based practices into your everyday work, you are more likely to recognize the correct answer on the C&E exam. All right, so again, we want you to reflect, we want you to act, and we want you to show yourself some grace. You have invested now at least 20 minutes of your time to explore your deeper comprehension of concepts related to the learning domain, specifically psychomotor learning domain. We hope this snapshot has been helpful. We look forward to seeing you for the next one. Make sure you also let a colleague know about Dr. Sellers Educate so we can achieve our mission, which again is to support all nurse educator colleagues on the journey to achieve nurse educator excellence. And hopefully many of you are on that journey to achieve C&E. Make sure you go to nln.org and check out all of the resources that are available for you on your journey to C&E, as well as checking out drsellerseducate.com. We're here to support you until you are successful, no matter how long that takes. We'll see you next time, everybody. Take care.